Hi, Professor Lukowski. I'm here again. My name is Riza, and I'm going to do the primary IV line, and then I am from your adult health class, term 2, section 1. Okay, so I'm going to check the MAR, the medicine, and then cross it with the allergies with the patient and everything, and I'll make sure that the medicine that we're about to give it to Mr. Jones, it's not gonna give him any problem. All right, so here's my MAR, and then I have fecomycin. It's the medicine that we have to give it to Mr. Jones, and then the medicine order, the doctor order is 1 gram per milliliter, and then what I have is 2 gram per milliliter, and then so after doing my math, it comes up with 0.5 milliliter. And then fecomycin is 50 normal saline infusing for 1 hour with 10 drops per milliliter. And then doing my drop factor, it comes up with 8 drop per minute. All right, so this is my MAR and then all the math that I did for fecomycin, and I'm putting it aside, and I check everything. I have my medicine, and then it is still good, and then the expiration date is June 2015, so it's good. And then I have the IV bag right here. I have everything ready, and then I'm gonna bring it to Mr. Jones' room. All right, so I'm knocking the door. Hello, Mr. John, I'm back again. My name is Riza, and I'm going to give you the primary line of IV for your antibiotic, which is fecomycin. And then can you please verify your name and then your date of birth? And then he's gonna give me his name and the date of birth. I'm gonna match it with the wristband right here. And then done with that, and then I'm going to wash my hands, cleaning my hands, and then because I'm going to inspect the side of the first IV line that I took, that I gave this earlier this morning. So I'm putting my gloves on, make sure everything is clean. All right, gloves is on. Here we go, glove is on, and then I'm going to pop it and then make sure all the IV side is good. There's no inflammation. There's nothing bad is going on around here. Everything's good. Okay, so I'm checking again with my MAR, and I'm checking this medicine is still the same medicine that I took earlier. So 0.5. I'm drawing 0.5 air. Pull it out, and I'm going to stab it. Oh, I'm sorry. Before I do that, I'm gonna scoop this. Okay, put it back on. Before I do that, I have to clean up the medicine container. So I'm cleaning it up. It's all good. It's clean up, disinfected. And I drew 1.5 air and inject it to the medicine container. And then I'm going to have 0.5 fecomycin in here. Make sure there's no bubble. It is 0.5 going up, and I'm gonna inject it to my primary IV. Okay, I'm injected, putting it inside. I saw it, pull out, and then scoop method for safety purposes, and it is going to be in a sharp container. Throwing in a sharp container, and I'm gonna mix my IV. And I'm gonna put label on it. I'm gonna put label of the name of the patient, the date, the time, and then what's in it, what kind of medicine that I put in it. So everything's already in here. And then I will make sure this is okay. I have my IV, primary IV line ready, and then I have to have the both ends. So I just want to make sure everything's still sterile. So I'm keeping the both ends away from the floor. Okay, this is both ends in. Alright, so I'm gonna clean, make sure this is all clean. This is still sterile, but I just want to make sure this is clean. Wiping it down, wiping it, and I have my alligator clamp. Put it on, so everything's still sterile. Okay, I'm gonna put this, hook it up in my line, and then this is up. So leaving it up here hanging. I'm gonna flush the IV side, and I'm gonna make sure that I still have this the correct line for this. So I'm going to clean it first. I'm sorry. All right, there's another one. I'm cleaning this side. Scrub, scrub. I'm scrubbing it, and then I'm scrubbing that, and then this is still sterile earlier, and then I'm putting it, attach it. All right. It is attached, and then I'm gonna unclap it, and I aspirate, and I see blood in it, so I still have the same line, I still have the same vein, and then it's still right. And then I'm gonna flush it, 3 counting. I'm gonna count it 3 to flush it. 1, 2, 3, and I'm clamping it. Now we'll unattach this. This is only normal saline to flush, and I'm putting it aside. All right, so this one, back to the IV line. I have to do, okay, I have to step the IV bag, opening it. This is all still sterile. Stab it. It is in. And then make sure this is squeeze, so it's a halfway go. Okay, and I already labeled my tube for my tube about the name of the medicine, and I already record everything, the date that I'm using it, and then the time that I'm using it. All right, and then I'm going to unclamp this. Unclamp this. I'm clamping it, and I will make sure that there's no bubble. Okay, hold on one second. This is, here we go. I'll make sure there's no bubble going on. So I'm running it. Oh, I have to take this off first. Sorry. It is off. I want to make sure this is running, so there's no bubble going on. Okay, this running, bubbles out. Alright, bubbles out, and I clamp it again. This is done. This is trash. Everything's good. Make sure this is out. And then I have to clean this again. Just want to make sure this is disinfected. Throw this one away. Scrub, scrub. It's all good. Throw it away. And I'm going to attach it with the primary line. And it is attached. And I'm going to establish that we have at 8 drops per minute, which will be 4 drops per 30 seconds. And then I'm gonna count it. 4 drops for 30 seconds or 2 drops for 15 seconds. It is 2 drops for 15 seconds. And this is all good. And I'll make sure that the IV unclamp. And this is all good. I'll make sure IV is unclamp. This is all good. The line is out, the line is right, the correct line. And I already re-established that it is 8 drops per minute, which is 4 drops per 30 seconds, and then 2 drops per 15 seconds. And I already count that, and then I'll make sure there's no trouble with the line. Everything is good. And then now I'm just checking on the side if there's any inflammation. I'm checking on Mr. Jones if he has any problem with that or any problem with the insertion. And then I'm going to record, I'm going to document everything that I did today. I'm going to discard these gloves. This is trash. And I'm cleaning up everything. Make sure everything's right. Make sure everything's in order. And I'm going to document the medication record the MAR, and then the record time, the drug, the dose, and also the routes. And then I'm going to state the condition of the IV site, and then also I'm going to record the document the client or the patient's response, and then I'm going to make sure that the patient know that I'm going to go back and then check on him 15 to 30 minutes just to see if if there is any problem with the IV side. All right, so that's my primary line for IV.